Is Nova Scotia's plan to offer nurses a $10,000 bonus to stay in the healthcare system enough of an incentive?
No, I disagree. I think we would need more of that. I work at a group home personally where all there are many nurses from Nigeria, and they come to group homes where they don't even have enough qualifications. But the 10,000 is so less for them to stay here, get their own house, support their family. So I feel like we would need more than 10,000 for them to just stay here. On top of that, there's a big healthcare problem in Canada. So I feel like they could use more nurses, and if there was a bigger budget, more nurses are more likely to stay, and then we'll have a better healthcare system here.
I think it's a good start, but I wonder if giving them reprieve on their education costs so that they're more incentivized to go in through the education, to stay in, and to stay in the local communities and stay here might be a good incentive as well.
I would argue that no, it's not. I think there probably needs to be more incentives in terms of a better package that nurses would be offered. I'm currently living out of province and notice that nurses have better pensions, better packages than Nova Scotia nurses. So I think that they would need those packages more than they would need the $10,000 incentive.
First of all, it's not going to solve the problem of burnout. So burnout is a critical part of the whole process, right? So it's a good thing, but it's not going to solve the problems. And by the way, a lot of people think that's a lot of money. It's not really a lot of money because nurses do make some money because they put a lot of work to in terms of overtime, but it wouldn't solve the problem because the issue is most of the time they work understaffed. So if you have two nurses taking care of 18 patients, 10,000 is not going to cut it, right?
I'm not too sure because nurses make what, about 70,000 to like 90,000 a year, maybe more. That's about a 10% increase, and that's a one-time thing. Maybe if they increased it each year.
I honestly, that's kind of hard. Like, a lot of people would think money is a great incentive, but I really think the main issue with our healthcare system is that nurses in general don't get enough respect, and they don't have enough time. The way that everything is planned out is our whole health system I don't think it's planned out very well. Like, even a lot of people in the mental health system say they go in for an emergency and they're sent home even if they say they're currently experiencing suicidal thoughts. They're just, oh, well, talk to your doctor about it and get sent off. There's definitely not enough healthcare workers. There needs to be more, but I find that our health system in general just needs to kind of find a way to better equip itself to have more space for more people and not just be like, oh, we'll give you more money. Well, why are people quitting? Why are people not wanting to work there? There must be a reason why nurses don't want to do this anymore.
Nova Scotia should be picking up the tab for your learning, and they should be saying, when you come out, we will have a place for you, whether it's in the various hospitals and whatnot around, across the province, whether it's VON or whatever, and that we will guarantee you 5 years of work once you come out.
I think it's unbelievable what they've had to go through in the last 3 years and even before that. I think it's horrendous to look at, for instance, I'm from Alberta, so I think our nurses got $1,000 bonus and many of them are leaving. It's just terrible to see with their education that we have funded, see them leaving in such large numbers. So yes, I think $10,000 at least.
Well, I would say the question we got to ask is, why do we have to offer it in the beginning? What created the problem that's led us to a shortage of nurses? Now, last 3 years, I would say a few things have happened that have caused people to choose to leave the health field or lose trust in the health field. So maybe the core thing should be getting to the heart of what caused the problem.
Well, I think it's a great start, and I think it's great that they're recognizing that there's a problem and that people are wanting to leave and actively making a change about it. But I think that 10 grand would only really mean something if they're committed to changing the healthcare system so that our nurses aren't so overworked and burnt out to the point where they are considering leaving.
I do believe that it should be an incentive for all those people that have been let go from their works because of this supposedly mandate. I do think that Canada needs nurses and we are short of them. So doesn't matter who it is. I think Nova Scotia would be great if they call back their people that they've put out, and offer the bonus to everyone. Doesn't matter their situation or their status on this.
I strongly believe in behavior and incentives because I spend kind of my life doing this. So I do believe that that is. You do have to structure it in such a way that they'll be in the system for a while in order to qualify for the full bonus. So you might want to extend that 10,000 over a few years to make sure they're nicely ingrained in the system, and then they're not just coming for 6 months.
Well, typically teachers and nurses are underpaid for what they do. So I think any incentive is a good thing, especially if you're losing those services, then you have to train new nurses, which could be more expensive in the end. So if I know whatever the situation is out there, if they feel it's warranted, I have no issue with it.
Okay, sure.
I don't think it's enough
No, why?
because we need to keep our workforce, right? So I don't think 10,000 is enough.
Well, I'm really glad that we're focusing on retaining nurses. Oftentimes the discourse is on retaining doctors, and I come from BC where we just offered an extra $150,000 in gross income for doctors. So what we're offering nurses in Halifax seems much more modest. I would also just add, though, as we protect our medical care system, we really need to recognize that that's sort of the last stop for our health. It's when we've fallen sick. What we really need to make sure is Nova Scotia investing where health begins, like in our neighborhoods, our communities, our childcare, our schools. Don't let medical care crowd out all that investment.
If a government wants to offer some incentive for nurses to stay in the public system, I can see them doing that. The amount, I can't really tell you what would be the right amount because I'm not on the ground, but something has to be done. But there is a concern here. If somebody's offering somebody $10,000 or $20,000 in one province, what about somebody 2 provinces over? So I think we have to look at this in a holistic way rather than cherry picking by the provinces.